Today we will be talking on the eligibility for the Commonwealth Scholarship Fellowship Program, which is open for Commonwealth middle-income countries. We are going to see who are really eligible. Does it mean coming from a Commonwealth country make you eligible? It's not as easy as many people talk on YouTube. So let's go through the site together. Commonwealth Professional Fellowships are for mid-career professionals from low and middle-income countries to spend a period of time at a UK host organization working in their sector for a program of professional development. Intended beneficiaries are mid-career professionals with 5 years relevant work experience working organizations in low and middle-income Commonwealth countries. These fellowships are offered under 6 development themes: science and technology for development, strengthening health systems and capacity, promoting innovation and entrepreneurship, strengthening global peace, security and governance, strengthening resilience and response to crises, access, inclusion and opportunity. Let's go to the eligible countries. Bangladesh, Belize, Botswana, Cameroon, Dominica, Eswatini, Fiji, Gabon, the Gambia, Ghana, Grenada, Guyana, India, Jamaica, Kenya, Kiribati, Lesotho, Malawi, Malaysia, Maldives, Mauritius, Montserrat, Mozambique, Namibia, Nauru, Nigeria, Pakistan, Papua New Guinea, Rwanda, St. Helena, St. Helena, St. Lucia, St. Vincent and the Grenadines, Samoa, Sierra Leone, Solomon Islands, South Africa, Sri Lanka, Tanzania, Togo, Tonga, Tuvalu, Uganda, Vanuatu, Zambia. For general condition, a Commonwealth Professional Fellowship covers a contribution to the host organization costs, approved fares, and personal maintenance. Other fellowships, awards, or bursaries that cover the same costs may not be held concurrently. The details of fellows who are nominated to the CSC will be kept on file. Basic anonymized demographic data for all applicants will be kept for analytical research. The CSC is committed to protecting personal information and to being transparent about the information we are collecting about individuals and what we do with it. The fellows must submit a health and disability form before a confirmation of award can be issued. They will be asked to sign an undertaking which requires them to return to their home country and their previous place of employment. Fellows are expected to start and complete their award on the date stated in their notification of award and for the full term. The CSC is usually not able to agree any changes to these dates after the notification of award has been issued. Fellows require a temporary work, government-authorized exchange visa to come to the UK for their award and must meet all relevant immigration regulations set by UK Visas and Immigration. Fellows must reside in the UK throughout their award, and seek approval from the CSC in advance for any overseas travel, which will be granted in exceptional circumstances only. Fellows must not undertake paid employment during their award. The CSC cannot provide a letter of support for any fellow to remain in the UK after their award. An award may be terminated at any time for reasons of unsatisfactory conduct, progress, attendance, or violation of visa conditions, or if the host organization decides it is unable to proceed with the fellowship for any reason before or during the award. For the financial assistance. Approved return airfare from the fellow's home country to the UK, reimbursement of the standard visa application fee, stipend, living allowance, payable monthly, or pro rata, for the duration of the award at the rate of £2,057 per month, or £2,553 per month for those at organisations in the London metropolitan area. Arrival allowance of up to £1,156.60, rates quoted at 2023-24 levels, including an element for warm clothing. A maximum of £3,000 per fellow can be agreed by host organisations for short courses/conferences as well as travel to visit other UK organisations where this forms an integral part of the programme. The application closes on Monday 5th of August, 2024 at 17 BST. Let's check these host organizations as this is where you will find out if you are eligible. Beekeeping is an income-generating activity widely practiced in developing Commonwealth countries in Africa. Bees are less expensive than other forms of livestock, they do not need daily care and feeding, and yet the market for good quality honey and beeswax is thriving. Our program focuses on fellows who are currently actively working in the beekeeping development sector. We welcome applications from early career and mid-career professionals interested to develop skills in beekeeping training, beekeeping and honey market development, education and development of training resources. To be eligible, they accept fellows from Ghana, Uganda and Malawi. The training program will build on the experience of hosting 14+ fellows since 2012. Firstly, the primary aim is to provide experience and training in modern geochemistry laboratories, alongside learning systems of work, e.g., quality assurance, HNS, infrastructure maintenance. To be eligible, the candidate should have an environmental geochemistry background, but with a primary interest in laboratory activities. We have focused on building a group across Africa with previous fellows to ensure onward benefit for fellows, but are open to other contributors. Causeway Coast and Glens Borough Council will offer a 3-month placement in its Environmental Health department, working to a detailed weekly program. To be eligible, this fellowship is only being offered to candidates who had a previously fellowship interrupted by COVID in 2019. Services throughout a person's life, in physical and mental health, and everything in between. The majority of our services are provided in the community. We also provide healthcare in prisons in London and the surrounding areas. To be eligible, multidisciplinary staff members of Mirembe National Mental Health Hospital, Tanzania, involved in the development of community mental health and substance use services. Candidates will be members of the project implementation team for this project, and who have the roles and capacity to have influence at a clinical and managerial level. Inclusion International's fellowship will provide fellows currently working within a national organization of persons with disabilities, OPD, in the intellectual disability movement the opportunity to work on disability policy and advocacy at the international level. For eligibility, applicants must be a current staff member or board member at an Inclusion International member organization. Let's go through the members list. Fellowship Summary: Neonatal sepsis is a major cause of infant mortality and morbidity in LMICs. This fellowship program focuses on building expertise in the early identification, prevention and management of neonatal sepsis. We propose a multidisciplinary program delivering comprehensive training spanning infection prevention control, EDI, trauma, sepsis, physical examination of the newborn, acute illness management, record keeping and care pathway management. For eligibility, we would invite applications from health professionals of any relevant cadre engaged in neonatal care from Fort Portal Regional Referral Hospital, Kasangati Health Center and Mountains of the Moon University, MMU, nursing and midwifery programs in Uganda and Mwenzi Hospital, Natsi Moja Hospital, Mwembalata Health Center and the State University of Zanzibar in Tanzania. We will also consider applications from other key health centers which refer patients into these hospitals. The Lifeline Network International Fellowship will enable applicants to hone skills needed to participate in local development within their context. For eligibility, LNI will prioritize candidates put forward by Lifeline Nehemiah projects based in Sierra Leone with whom LNI has relationships spanning over 20 years. The candidates must be local young emerging leaders who have a commitment to develop their skills and character for the good of the LNP's vision. The recent outbreaks with new infections such as COVID-19, Ebola, swine flu, avian flu, and SARS in LMIC countries have underscored the importance of availability of clinical microbiology and infection control services. Furthermore, antimicrobial resistance is now recognized as a global emergency. High-quality clinical microbiology services, infection control, and antimicrobial stewardship are essential to prevent the emergence of antimicrobial resistance in the hospital and community. For eligibility, applications are invited from suitable mid-career medically qualified medical microbiologists to the Clinical Microbiology Fellowship Program. Applications are encouraged from employees of public sector or charitable organizations in low and middle-income countries. 3 fellowships available in a large NHS Foundation trust in the northeast of England, as follows. 1 is anesthesia, to gain exposure to a range of anesthesia practices, supporting the development of this specialism in Tanzania. 2. Speech and language therapy, specifically to support the development of specialist stroke services in Tanzania. 3. Nursing, specifically to support the development of specialist stroke services in Tanzania. For eligibility, applicants eligible from Kilimanjaro Christian Medical Center in Tanzania, as nominated by the hospital's senior management team. The fellowships will contribute to an improvement in the safety of patients in the mental health unit of Gulu Regional Referral Hospital. For eligibility, mid-career professionals working in Gulu Regional Referral Hospital in Gulu, northern Uganda. The fellowship will provide focused training in key areas of the nominee's skill sets, with nationally recognized qualifications in some instances. For eligibility, the TACKLE program will be open to fellows from any of our operational countries, East, West and Southern Africa, and to those currently engaged in our sport for development work. Places will be open to coaches, staff and partner organization members, and the course of study will not affect work contracts. The UCL Gender and Sexuality Fellowship Program, based in the Research Department of PCPH and Division of Psychiatry, will build on the success of hosting CSC fellowships in 2024. The program will support HCP in low- and middle-income Commonwealth countries to augment the rights, freedoms, dignity, and inclusion within healthcare of communities discriminated against because of their sexual or gender identity. For eligibility 1, healthcare professionals working in low- and middle-income Commonwealth countries in roles related to health service policy, planning, or delivery, with at least 5 years full-time equivalent experience. 2, a commitment to supporting the rights, freedoms, dignity, and inclusion of communities who are discriminated against because of sexuality and/or gender identity. 3, applicants with a long-term goal focused on reducing stigma for LGBT. The School of Health, Sport and Bioscience at UEL will host 5 fellows through the Commonwealth Professional Fellowship Scheme. For eligibility. As the School of Health, Sport and Bioscience at UEL will host these fellows, it is expected that the fellows should have academic backgrounds in the areas of pharmacy, chemistry, biochemistry, biotechnology, or related disciplines. The Global Burden of Disease Report, 2015, describes hypertension as a major global risk factor, ranking second only, and linked to inadequate diet. It is a key risk factor for non-communicable diseases including stroke, heart disease, and chronic kidney disease. For eligibility, we would invite applications from health professionals, of any cadre, engaged in hypertension prevention and management from Fort Portal Regional Referral Hospital and Kasangati Health Center and Mountains of the Moon University Nursing and Midwifery Programs, all in Uganda, and Kilimanjaro Christian Medical Center, KCMC Mwenzi Hospital, Natsi Moja Hospital, MMH, Mwembalada Health Center and the State University of Zanzibar, all in Tanzania. The Science and Technology for Development program is a comprehensive fully funded 3-month fellowship program designed for professionals from India, Pakistan, Bangladesh and Sri Lanka working in energy materials, processes and devices for net For eligibility, our program will be open to science and technology professionals who are working towards the sustainable development for net zero in India, Pakistan, Bangladesh and Sri Lanka. By selecting a homogeneous cohort with overlapping cultural history and professional experience, we can tailor the program to address the specific development challenges facing these countries, maximizing the impact of the program upon the fellows' return home. Wessex Global Stroke Partnerships are pleased to announce that they can support up to 4 fellows on a CSC fellowship from February 2025. This will be a 6-week program for healthcare professionals traveling to the UK to observe National Health Service (NHS) professionals. We accept applications from individuals supporting the delivery of stroke services in either a clinical or non-clinical role. For eligibility, eligibility includes any multidisciplinary team member working in stroke care, doctors, nurses, physiotherapists, occupational therapists, speech and language therapists, or other disciplines, in either Ghana or the Gambia. We welcome applications from those working in non-clinical stroke administrative or research roles that support the delivery of stroke services.